Happy Thursday, everybody. It's me, Brandy Pett, with Yes, I Am the Veteran. And my beautiful co-host, Miss Melissa, is unable to come on tonight. She did have a bit of a car accident. She's fine, but she'll be on next week, but she will not be able to be on tonight. But we are so honored to have Dr. Prakash on, who has a lot of amazing information for chiropractics and about chiropractics. I know it's an issue that a lot of us as military members have questions about, or we've had issues with one way or another. So before we get too deep into this, Dr. Prakash, can you tell us a bit about yourself?
Yeah, I'm happy to be with you. Thank you for having me on. And I say hello to all your audience. I'm a chiropractor, been practicing for 20 years in San Antonio. And I had my own office since beginning. And I'm glad that I got opportunity a couple of years ago to start seeing the veterans. And it's great that they allow veterans to go to community care. I'm very happy about that. And my background, I have bachelor in medicine and then master's in microbiology and doctorate in chiropractic. I went to school for years. I don't wish that for anybody. However, I'd be glad to answer any questions about chiropractic.
Absolutely. And didn't you also used to like bodybuild or professionally lift?
Yes, I did weightlifting, Olympic weightlifting, and I have a silver and 2 bronze medals from university and colleges of Iran. And I was in preparation for Montreal Olympic, but I never got elected to go.
Wow, that's amazing.
78.
I saw that picture in your office. So those of you guys that don't know, I have to do chiropractics quite a bit because of how I walk. That's actually how I met Dr. Prakash, and I saw that picture. That's why I had to ask about it, because I always see it whenever I come in there when we have to do stretching. I'm like, yep, that was him.
The audience actually can go to bashchiropractic.com or bakashchiropractic.com and read about the history and see pictures and everything.
Nice. And also, I know tomorrow is the anniversary of the passing of UFC Hall of Famer Kevin Randleman, and so I definitely wanted to send warm wishes to his family, especially right now. I know that if you've seen any of his clips, he's definitely brought you probably many patients, I'm sure. But for you, when you went from being an Olympian into working into the field of medicine, like for you, was it more being like personal experience, or did you want to start helping people when you saw them having similar injuries that you thought maybe were treatable?
Injuries, definitely. Sport injuries are a specialty, and also chronic pain is. Many veterans actually suffer from chronic pain of 10 years or 15, 20 years old, which they need a special attention. The past experience of my being involved in sports definitely helps.
Well, I mean, I think you definitely think about it from an athlete's point of view, which is probably really important sometimes, depending on the type of injuries that you're having to deal with. What would you say are the most common medical conditions that you usually treat on service members for chiropractics?
Many injuries due to wearing a lot of heavy gears by veterans, like having 20, 30 pounds of gears on them and exercises, walking, running, um, lifting, they definitely uh, injure a muscle or ligament or a disc. And many of these last for years. I can't believe that um, some of my veteran patients have pain for 15 years or 20 years.
Hmm.
And, uh, I'd be happy. We've been successful to give them some results, and I'm very happy about it.
And honestly, like the difference is huge. Like I know I had to start seeing you around the time I was running for Miss Federal America because I couldn't turn left. Like literally, I was like Zoolander. I couldn't turn left, and you had to help me because I literally had so many issues that I had not treated in so long that I was suffering because of it. And I mean, I know a lot of veterans they don't get the treatment that they need as well, and they a lot of times are denied or they think that there's no recourse for them when they get out of the military. Um,
Fortunately, the uh, community care now would send or approve 12 visits for veterans, 12 visits per year to go to a chiropractor of their choice. And I really recommend to the veterans that follow with their PCP doctor, primary care physicians, and ask to be referred to a chiropractor that can help their condition. Um, the I hope they do.
well, I know that a lot of times that you have to do like X-rays. You have to be, there's a lot of the qualifications that you need to have it justified. But once it is, I know some places have the clinics that have like chiropractors on staff. But I know for me, I had to go to community care because I had issues with my chiropractor. There's only one here, and he had a lot to say about me being a divorcee, and it was awkward because I didn't feel it was patient related. So I was very thankful that I was referred to you, but so few women actually use like chiropractics, and they should, because I mean, if you look at the statistics, like they say, like only 1.6 or 1.7% of all people that actually look for chiropractic as care are service members. I'm pretty sure that there's way more than 1.6 or 1.7% of us that have back pain or neck pain or anything similar to that that could be corrected with regular routine care to the chiropractic side.
Yeah, that's right. That's right. The number of women who uh, get referred are very little, not very many.
Yeah.
Uh, Most patients, like 90%, are men, and it um, many because I think they have not had any contact with chiropractors in the past,
Yep.
so it's a mystery for them.
Yep.
And this is like a myth that should be broken, and they try
Yep.
should try. It helps them. The medical medicine can only help so much. You can only take so much drugs, and you can only take so much injections, or God forbid, surgery. But chiropractic believes, or I believe, that the health comes from within. So therefore, if we remove the interference of nerve impingement or misalignment, like kink in the neck or a kink
Mhm.
in the vertebrae, if you remove that, it takes the pressure off the nerve,
Yeah.
and you definitely it helps. So physical removal of the kink, we call it subluxation. It's really helps to relieve pain a lot.
I know one of our viewers is asking, are the adjustments harder on a woman's body? is there more like trauma that would be, I guess, occurring from an adjustment?
No, no, absolutely not. Actually, each adjustment, when you do adjustment on vertebrae, we use the force necessary according to the person. I have adjusted my daughter when she was 6 months old.
Wow,
I
yeah, those
have
are the
had
crazy ones to watch.
yeah, I had babies that they had like colicky babies who had no uh, medical problems. Like
Mm-hmm.
their colicky was not due to uh, uh, gas or stomach problem or ear infection, or all of that. Those were ruled out. So what is left is neck pain or back pain. And the way you can tell is if the baby can not turn to the right or left, you
Hmm.
know, or limited range of motion like you had,
Yep.
Ms. Brown. So, and removing it, it helps them a lot, and it can help colicky baby.
One of our viewers is asking, do you chiropractors or do you have doctors like yourself that write reports on like how bad veterans' back or injuries are when you're treating them? So that way they can use it to strengthen like any claims that they have with the VA because you're assessing their back.
Um, are we helping the doctors in the VA to assess the veteran better?
Yes. So they usually they would just ask for like a review
They,
basically.
yes, every visit and every examination we do on veterans, we have to report to VA.
Yep, absolutely.
So that they get examination notes, and they get office notes of what we do every time a veteran come there, like exercises, traction,
Mhm.
adjustments, electric muscle stimulation, whatever we do to help the veteran, it has to be reported. And um, sometimes I had patients in the past who have x-rays done and they come, we will do adjustment and exercises and everything, and they improve only to a limit.
Mhm.
Uh, and I would write a note, ask for or suggest MRI, for example. And
Mhm.
the PCP, most of the time they agree and they do an MRI, and we get a lot more information on patients.
Yeah, I think he was meaning like a nexus letter, where it's like a basically summary of the case. But we'll go on to the next question. But he can definitely reach out to us through our Yes I'm a Veteran podcast page, and I can connect the two of you, and you can answer that outside of the podcast as well. Um, and how would you say that stretching helps maximize effectiveness for adjustments that you do? Because I know you do in conjunction.
Yeah, when stretching is a great tool that helps when helps release the vertebrae. Like for example, if you have a kink in your neck and we adjust it and relax the vertebrae, the following stretching would keep it relaxed,
Okay.
keep it from coming back. And also stretching before adjustment would really help the adjustment go easier.
See, that's like something you never hear about from a chiropractor is stretch before you come. And I always wish that they had something like that in the waiting room or something, so people could really start to stretch before, they get adjusted, because it's natural for us to tense up and not allow our muscles to relax enough to allow the adjustment sometimes.
I rather give a stretch myself, and generally I give them stretches and then adjustment.
Okay. Yeah, I know like sometimes people use like I know like TENS, heat therapy. Some people use just like point pressure, where they add that and then they move it like to try to work out adhesions. There's so many different modalities out there.
Yeah, the greatest tool that I have in my office is the uh, decompression, or
Yes.
stretching the vertebrae.
Yes.
And that helps to separate the vertebrae a little bit to take the pressure off the nerve and the disc. And that's really the big gun. If a
Yeah.
patient doesn't improve, the big gun.
It's like move them or move those vertebrae or else. No.
That helps greatly.
I remember
Yeah.
the first time you explained it to me, I was like, there's no way this is gonna work. Like, this is not gonna work. And as soon as you put me in it, I was like, I don't have back pain. This feels odd. Like, I always have back pain or hip pain or neck pain. Like, this isn't normal to not be in pain. So it was odd that it was like within minutes of you putting it on.
Yeah.
So, like, is that something that's only you
Yeah.
only can lay down, or can you go vertical as well
Uh,
for the table?
you can do for the neck, you can go vertical. You can, no, you then,
I was like, I don't know.
well, you cannot do that with that table, but you can do traction on your own. For example, hanging in the water in the
Yeah.
pool, or hanging from the ceiling.
My mom used to make my sister hang off a clothesline back in the day. That's how country I am.
Right, right. Frankenstein type.
Yeah, I just have the scars of Frankenstein. I can't hang upside down like Frankenstein. But what was I gonna say? Um, how long have you been using the spinal traction therapy, that machine?
More than 10 years.
So
This is something new. That came on, I guess, around 20 years ago, and it's been the big weapon to help uh, patients without surgery. Help these herniations without doing surgery. And we have helped, our chiropractors have helped a lots of patients and got them out of surgery by doing decompression. And I haven't seen any medical doctor who does not uh, agree with that.
well, what I think was awesome is that it's something that, I mean, I was fortunate enough to try when I was referred for the chiropractics, and it's something
Yeah,
I'd never seen before, and I've seen all different kinds of contraptions because I've been doing chiropractics for over 20 years. So I mean, for me, even I had never seen it, and I mean, it's something that I that's why I did the quick video that you guys may have seen about a week and a half ago. We actually had quite a bit of views on it. A lot of people found it really interesting that I was doing, and they're probably like, "What exactly is she doing?" But I can put a video on our page as well with a better clip of what it does specifically. But I mean, basically, what it does is it just pulls apart. In Dr. Prakash can show you the vertebrae he's got over there and how it
yeah,
works. But basically, when you have an impacted vertebra, you're not able to get any blood or nourishment into that tissue, that space. So basically what it does is it pulls it apart for what is it, 50 minutes? How long is the intervals?
yeah. We can do 15 to 30 minutes.
Okay. So it's basically opening like a vent, I guess, for the areas for
Yeah,
healing to occur.
and this opening this would allow the disc to absorb water and get thicker, actually. And the research shows pulling and relaxing, which we do with that table, improves blood flow around the disc and helps repair itself. So it's really, and if you look at here, this is the disc herniation. I don't know if you can see it. That's the disc between the two vertebrae, and the herniation is little bulge on the side. And when you pull it apart, it causes a negative pressure inside the disc, which can suck back some of this fluid.
Wow.
The disc actually is like a donut with jelly inside.
Okay.
Right in the center of the disc, there's a nucleus, which is jelly. That's a shock absorber. So when you jump down from a step or somewhere, this jelly would prevent the bone from cracking. So it's like a shock absorber. But
Okay.
in some places, the jelly would protrude through this fibers of the disc and make a bulge on the side, or herniation or protrusion. And this, um, if it's near a nerve, can pinch the nerve and shoot pain down your leg, or down, if it's in the neck, down your arm.
Mm.
And the leg they call sciatica. So you get sciatica. It's the nerve impingement, basically, generally by a disc herniation.
Yep.
So we've been uh, very successful in helping leg pain or reducing the leg pain with decompression taper. So it's been good. I really refer the viewers to read our reviews on Google, and these are written by actual patients, and they can see how um, the table have helped them.
Does it hurt? Like, I mean, like, I mean, I know, but like, I mean, do most of your patients say that it hurts them when, if you know, it's like severe?
Only maybe 2% of patients cannot take that. 2-3% of patients, if they have uh, posterior elements, or the back of the vertebrae, if they have issues with the joints called facet joints, if they have problem with those joints, they cannot normally take the pull, and and they express pain, and that's on maybe 2-3 patients, 2-3% of the patients.
Okay. Hey, big girl. So that actually almost happened to me too, but a funny story. I said, you know, I'd rather take the morphine.
Yeah,
Thinking back on it, I'm glad I don't have to have some double A's.
yeah.
But no, for veterans, would you say that this is something for acute pain or chronic pain? Sufferers would have like the most benefit from it.
It helps for both acute and chronic pain. But most, I mean, 99% of the veteran I've seen, they have chronic pain.
Chronic, yeah.
And the older veterans generally have collapsed discs. They have, the discs are narrowed. We call it degenerated.
Hmm.
And uh, and that also, when the disc is narrowed, it approximates the two vertebrae together, and it can also pinch the nerve. So opening those and stretching them would really help, and they express a lots of pain relief with those. The younger people usually have a disc herniation. Um, and their disc is not yet degenerated as much.
What kind of spinal issues would you say you would not allow on something like this, or you would not recommend chiropractics to?
Um, the injuries, you mean?
Yes, like the common injuries that you may see, or you may have people come in that you have to turn them away just because it's something that does not
Uh,
benefit them.
if it's like, if a person has 10 out of 10 pain, 10 out of 10 pain, very acute pain, or they have, for example, foot drop. Uh, Foot drop is because of severe nerve impingement, or fracture or something, we refer them. Those are the cases that I cannot treat.
Yeah, I know I have foot drop, but it's not the same kind of foot drop. It's because my whole peroneal nerve is like gone, but it's not like the normal ones where they're like muscle related or minor in
Those
nature.
yours is not from back. It's
Yep,
just
definitely.
okay.
No, it's just from, lack of medical care and arterial blood clots and, the necrotizing fasciitis aspect of it, yes. But so you've got you got a lot of people popping in and saying how much you have helped them. Christy Harmon McCoy says Dr. Bakesh has helped our entire family. Highly recommend him, and that's not the first one. So definitely people are like, hey, I know him. I remember that guy. So you definitely got some love on here tonight. I love seeing that, especially because, I mean, in the VA system, trying to find things that you feel work for you and people that fight for you. It's sometimes a challenge, and then when you find them, they leave, and you're trying to back to square one. So, I mean, I definitely can't recommend Dr. Bakesh enough. I mean, like I said, how I was recommended to him was through I started with my primary care provider. I asked for a referral. They had to do the X-rays at that point. And then after I was not able to be seen by my chiropractor from my clinic, they referred us at that point.
That's amazing. My 90% of my patients are medical referral.
Really?
Only 10% I get from internet or another patient, or it's several other primary care physicians and pain specialists refer patients.
We got that magic touch, though. I mean, I wasn't a believer at first either. I was a little salty. I was like, the VA is not going to send me anywhere that's going to be making me feel better. So, when I went in, I was like pleasantly surprised. I was like, no way, this never happens to me where I walk out without pain.
Yeah, I really, my message to veterans is give chiropractic a chance. They help them. It will help you.
And go for more than one visit. You got to do like the whole time they recommend to just see. The worst thing that'll happen is you'll feel better.
Yeah, at least give 5 or 6 visits, and if you're improving, do more. That's what I tell my patients. Give me 6 visits. If you are improving, then we do more. If not, then I write a letter to your primary doctor and make suggestions.
Okay. And when you pull the traction, do you pull traction from the neck or the back? Like, because I know I've seen it sometimes where it's like it looks like the head's getting pulled, and sometimes it looks like the traction's getting pulled towards from the feet.
Well, we can do both. We can do both. Neck traction helps of course, the neck vertebrae if they have a disc issue in the neck, or if you have a lower back pain, then we stretch the low back. The middle back, thoracic area, middle back, you cannot stretch because of the rib cage. It's very sturdy.
Makes sense.
So no traction there, but adjustment, yes.
Okay. Interesting. I guess you didn't really think about it, like being able to adjust through your thoracic cavity. That makes total sense that you said that, though.
Yeah.
Can you imagine like the kind of traction you'd have to pull? Like a leg up.
In traction has been around since thousands years ago. The old they either walk on their patient's back, old doctors, or they pull their leg or they pull their head, and that helped. That's been in it's been in the history.
Mm-hmm. I mean, and it's interesting that we never really see it enough with like chiropractics and military members because, I mean, think of how much you have to carry in your battle rattle. Like, it could be 100 to 250 pounds plus. I mean, that's a lot of weight to put on top of your skeletal frame and carry for however 12, 16 hours or more. I mean, and then putting it down, if someone pushes you or you fall or something like that, that's a traumatic injury right there. And a lot of times there's that thing called don't go in, unless you're, a crybaby or something, and you don't get treated until you get out, unfortunately.
Or I had a veteran 3, 4 months ago. It was a parachuter, and parachute down and did that over and over and over and hurt his back.
I mean, that's pretty standard like that, or like, what it microfractures like in the
Yeah,
shins.
yeah.
Like, and it's crazy that
The,
that becomes standard with them getting out. Like that shot him, I think it claimed.
the benefit of veterans going through community care and go to the aesthetic chiropractor is that we spend a lots of time with patients as opposed to the chiropractors in military, because they don't have time. They are so busy.
Yeah,
All
these are
they
like
do
one
is
or
just
something.
adjustment. They adjust and you go. In in community, we don't just adjust and say go. We do therapies. Actually, we do a stretching. I do stretching. I Each veteran at least spend 45 minutes to 60 minutes in my office.
Oh yeah. And I think the average appointment I think I had for a chiropractor in the military was about 15 minutes, maybe
Right.
20. I think, yeah. And I never really, I mean, they would give you like a sheet with the stretches on it, but they never went over it with you. They never made you do it, So a lot of times you didn't really notice that much of a diminishment because none of us actually do what we're supposed to and do our homework, and it doesn't help us.
The chronic pain that veterans have needs time. If you don't spend time with them, you cannot give them results. And unfortunately, the chiropractors in military, they don't have the time.
Yeah.
They're so busy. They know adjustment well. That's what they do, and you go out.
Yeah.
But it's not enough for 20 years of pain.
Yeah. It's pretty grounded in there.
Yeah.
And plus, just like having it sitting there and healing basically in place, you have to work all like the adhesions around that area to get to that area that's damaged to adjust it even. So, I mean,
Correct.
that's definitely a huge challenge as well. Would you say like after adjustments, you would recommend like heat therapy or only for like a severe case
Normally,
or not at all?
I generally recommend
I
icing, ice after the adjustment. Yes, and um, I give home stretching.
mm,
I give a sheet of exercise to do the days they don't come to see me, but the day that they come, we do their stretching in the office. And after adjustment, we do, as you know, electric muscle stimulation and icing if patient needs it. Otherwise, at home, I usually recommend ice. You can do heat and ice if you want, but uh, do finish with ice.
Yeah, I know that I've had to use my TENS unit sometimes after the therapy to kind of help like my neck sort of work out the adhesions around the area, so that way the next time I came in, it was easier to be adjusted.
Yeah.
Because sometimes like your body like doesn't allow you to relax enough where you can actually adjust that area. Unfortunately for me.
Um, I'm so glad that the veterans have opportunity, or the military allowed veterans to have opportunity to see the community chiropractors.
Yeah. And I mean, chiropractic really hasn't been something that's been done for that long in the military, like what, 20 years? Like they started in 99, treating chiropractics as a separate entity. So, because they used to have osteopaths, which were docs that could make minor manipulations in your bones, but that's not what they studied full time. A lot of times, I mean, they had patients, like full load of patients. So, trying to get an appointment with an osteopath was difficult even. And that's if they chose to identify as an osteopath to the SGH when they got to the new unit.
And if you think about it, more than 60% of the osteopath, they just practice like medical doctors.
Yeah.
They even don't do manipulation.
Yeah, because they get tired of it. They're like, I'm tired of adjusting backs. I want to take care of, this lipoma, or I want to do this. It's not nearly as cool.
Correct.
I always try to learn from my docs, but they would never teach me because they didn't want to do it as patients. I was
Yeah.
like, what would you recommend for anyone as far as like resources to maybe look up stretches? Like if they were wanting to kind of look at some of the stretches similar to what you have, would you say like it's on your webpage that you had given, or would you recommend looking somewhere else?
Um, Stretching normally, I don't put them on the website or anything because
Okay.
I rather I rather work with the patient, with my patient, show them how to do it, and then give them the sheet.
That makes sense.
You give anybody any sheet, and they may do it wrong. They may hurt themselves.
Yep.
Depends on their condition also. I'm so glad that the VA hospital does take x-rays before they refer veterans to us, because the x-ray also reveals a lot.
Yep.
For example, I just have a patient right now that I'm treating, and I had one last year that they had slipping vertebrae. That means a spondylolisthesis is the condition that they slip forward a little bit. One of them is slip forward on the other one. And these ones, the exercises that I give to a normal person, you cannot give that to them. You have to modify the exercises for them.
Mm-hmm.
Therefore, um, and if they do those exercises that the regular person does, then it may make them worse.
Yeah. That mean I
So
mean
I
go ahead.
rather see their x-rays, and I rather do the exercises with them and then give them the sheet.
That makes sense. I know for me, I was surprised when I had got my x-rays how bad my back and upper spine was, just because of the fact that I had been referred to a chiropractor for my lower back, but he saw that I had fused vertebra in my cervical spine, my neck, but didn't say anything because I was there for my lower back. And so he knew, and like he told me, hey, you need to have your doctor put this in for this. But instead of doing that, he didn't tell me anything. So I didn't know quite literally until I walked into your office. And that's the thing, is that a lot of veterans, I don't think we realize, us living with the pain every day, and us thinking, that's normal, is not normal. And there's things that we could do about it that could really change the quality of our lives.
Correct, correct. You are absolutely right. The veterans should not put up with pain. You should not, even elderly. You should not. They think many people think when you age, you age with pain. You shouldn't. You shouldn't have pain when you age.
Yeah. Words to live by. I'm going to remember you said that when I'm like 40. I'm hurting now. So is there any other resources before we wrap up tonight, or anything that you would like to let our veterans know?
I think I talked a lot about the importance uh, of the veterans not put up with pain.
Yep. So
Seek relief, and don't you think that you have to put up with pain? There is always a solution.
yeah.
If it's not medication, it's chiropractic. If it's not chiropractic, it's something else. So there's acupuncture also. There's other modalities that they can use to help themselves.
Okay.
So it's they deserve the best treatment, for what they have done for the country, and they should get the best treatment. So try to don't put up with pain, and please seek treatment.
Absolutely. Yep. Be your own best advocate, guys. Dr. Prakash is out of San Antonio. And he, like I said, I found him through community care, but he does have a clinic outside of the VA. But if you want to be referred to him, I mean, definitely in the San Antonio area, definitely you can ask for him by name when they schedule you because they give you your list of providers. Be sure to just say his name, and that way they can get you to him.
Yeah, they can look up BakhshChiropractic.com or Google Bakhsh Chiropractic.
Yep, absolutely. I cannot recommend him strongly enough. Like I said, if you guys have any questions that you'd like me to have him answer for you, or you want me to link you up, if you have any questions, please just let me know. But like I said, guys, it's okay to not be okay, but definitely be your own best advocate to be the best version of yourself that you can be. But well, I think we jawed your ear off enough tonight, but thank you again so much, Dr. Prakash, for coming on and talking about chiropractics. We definitely appreciate all the wealth of information you did give us.
Thank you for having me on. Appreciate it, Miss Brand.
Thank you. Have a good night, guys.